The most appropriate initial management. Um, okay, 30-year-old man, history of chronic primary adrenal insufficiency, is admitted to the hospital with fever, vomiting, and abdominal pain. He is hypotensive and tachycardic. Laboratory studies reveal hyponatremia, hyperkalemia, and hypoglycemia. Um, Initial management. Okay. Um, so in general, when I see people are hypotensive, I usually start with like IV fluids. So I would probably start with some type of fluids. And then I guess he has the primary adrenal insufficiency. So we need to think about like replacement. So hyponatremia. Honestly, I would, well,
What's your gut say?
he like, to me, he seems pretty sick. I might just start with stress dose hydrocortisone.
Yeah, that's gonna be your best answer, right? Because
Okay.
he is stressed, right? He's sick,
Yeah.
right? So you definitely want to replenish, right? Because he's already lacking. He's probably already supplemented with steroids, but now he's in an adrenal crisis, right?
Yeah.
And so definitely for sure, right? Always when you have vomiting, nausea, and it lands you in the hospital, IV fluids, right? Is going to be your best bet, right? And always think about, in every situation, right? Internal medicine, general surgery, right? You think about your ABCDEs, right? And so those are your kind of your critical things that you need to fix, right? Your airway, your breathing, your circulation, right? And so
Yeah.
if you're anywhere on there, so fluids is on there, right? So your circulation, right? So you need to definitely kind of give IV fluids here. And same with diarrhea. Everyone always forgets about that, right? Bleeding, diarrhea, vomiting, right? You need IV fluids, right? And then after that, you got to be like, okay, so he also doesn't have enough steroids, right? Because his adrenal glands aren't working, so you got to replace that. So here you want to give pretty high dose, high dose steroids. So